I am Dr. Jawahar, Director Jawahar Hospital, family physician from Tamra. Today we are going to discuss about hypertension. So this is a common disease where we see very often patients coming with high blood pressure. So we will discuss about the cause for hypertension, the treatment modes, and what is the normal blood pressure, everything. We can have a brief discussion today. So what is called hypertension? Hypertension is it's mainly due to the pumping of heart, which pumps blood in the arteries. So if the heart pumps the blood against the stiff arteries, the actual blood pressure gets raised. So that is called the hypertension. So what is the normal value of your blood pressure? So in that context, it varies with the age of the patient. So young patients, usually the BP is 120 systole and diastole is 80 millimeter Hg, as we all know. As the age goes on, the blood pressure is raised. Say if 40 years old individual comes to your hospital, if he checks his blood pressure, it is around 140, but 80 could be normal value. So what are the causes for hypertension? We can have a brief, there is oversee about that common causes for hypertension. First and foremost is the age. If the age of the patient goes up, there is a high incidence of hypertension, because at the age goes on, the arteries is getting stiffened due to many causes. Sometimes the patients might have high cholesterol levels, and these cholesterols might get deposited in the arteries. So it might cause hypertension. And again, our food habits. Sometimes this all over the population, they used to have many of processed and junk foods. So all these junk foods might have it is increased cholesterol values, which can always bring hypertension. And the third thing is some patients will have this comorbid condition. Say they might have diabetes mellitus, obesity, increased body weight, increased fat content. So all this, or kidney diseases as well. So all these comorbid conditions can also play a role in bringing hypertension. And stress factors. So of late, all of us will have this low amount of stress in your life. That is improper sleep, seeing there is gadgets for a prolonged time during sleep hours also, or feeling very much that is anxious and depressed. So all these can cause hypertension. So how we are going to tackle this hypertension? Once a patient is diagnosed to have hypertension, what are the treatment options we have to treat hypertension? For example, we can broadly classify the treatment of hypertension into non-pharmacological way and pharmacological way. What are the actually non-pharmacological way to treat a patient of hypertension? The first and foremost is exercise. So all the patients with hypertension, say if their diastolic BP is about 90 millimeter Hg and systole is about 140. So these borderline hypertensive patients should be started with the basic exercise. Aerobic exercise is a very good exercise which everybody can practice very easily. Say a patient or an individual, they should either do brisk walking, jogging, or swimming. Say that is what we advise to patients is 150 minutes of aerobic exercise per week. Say if a patient does 30 minutes of exercise per day, he is expected to do 5 days in a week. So either brisk walking, swimming, or jogging. So this will be very much helpful in bringing down their high blood pressure. Second one is diet. either a Mediterranean diet or a dash diet, which contains plenty of fruits, green vegetables, lean meats. So all this, and there is decreased amount of salt intake and spice. So all this will bring their blood pressure by a diet means. So the food pattern is very important. So people should take only fresh fruits, and they should avoid all those junk foods, processed foods, which is available very easily. So dieting is very important, coupled with aerobic exercise. And along with this, they should have a very good sleep. In this context, patients are advised to go for the bed as early as possible. And they should have a minimum of 7 hours of sleep in the night. That's very important, especially deep sleep. So in that context, either they can practice meditation or yoga to actually de-stress themselves to have a good sleep. So all this comes under the non-pharmacological way of treating hypertension. Pharmacological way, we have got plenty of that is medicines to treat hypertension. Especially, it all depends on the patient's comorbid conditions, their presentations, and their symptoms. So either we can choose a beta blocker, or we can go up to ACE, ARB, or alpha blockers. And especially in this May 17th is International Hypertension Day. So on this day, we should have a principle in means, a protocol in means to treat hypertension in a methodological way, either non-pharmacological way for say 2-3 months. If he is borderline hypertension, we can try this non-pharmacological way. If he fails in that, if still the blood pressure goes on increasing, then we can try the pharmacological way. Or if the patient presents with a very high BP with complications, straight away we can put the patient on treatment. So on this May 17th International Hypertension Day, we should take a pledge in defeating hypertension and prevent patients from the complications of hypertension, like cardiovascular diseases and mortality, kidney diseases, and all those complications we can prevent easily, provided patient is added to the treatment and he is very punctual in the checkups and medications. So that is what I would suggest is, always if you are above 30 years, you should check your blood pressure regularly with your family physician. And if he tells that you have got a borderline hypertension, we should go for a complete blood screening. What are all the comorbid conditions you have? That should also be taken care of. And apart from that, this non-pharmacological way of treating hypertension, say exercise, sleep pattern, and food habits, and following a Mediterranean diet or a NASH diet. So all this will be helpful in bringing your hypertension and controlling your blood pressure. And apart from this, if you are having a family history, say your parents are hypertensive or your parents have got a cardiac problem, we should screen all those complications of your parents, or some sort of complications might run in families. So we should identify what type of complications our parents are having. We should screen for that. So in that way of a scientific way of approach, we can tackle this hypertension. So thank you all, and I will always see that patients are being educated properly for this all treatment options. Thank you all for listening, and I thank everyone for giving me opportunity to talk this. Thank you.